Hello, doctor. My name is David Menendez. My topic is early-onset stroke and vasculopathy associated with the mutations in ADA2. Definition. What is vasculitis? Vasculitis is a group of medical conditions which cause damage to the blood vessels through inflammation. Depending on which blood vessels are affected, vasculitis can be classified as large vessel, medium vessel, or small vessel vasculitis. Learn about the signs and symptoms of vasculitis such as purple bloody stool in the urine and breath. Next video.
So here we have our vascular man, and he's got blood vessels that supply every part of the body. He's got blood vessels supplying the heart, blood vessels supplying the lungs, some supplying the kidney, the liver, the intestines, the skin, the nerves, really all over the place. And so here's a blood vessel I'm drawing. So of course your blood vessels will be carrying blood, but they also carry nutrients and oxygen and all sorts of proteins. Now, what happens if these blood vessels get damaged or inflamed? So what if the inside of the wall of the blood vessel gets very inflamed? Well, intuitively, it makes sense blood will not be able to pass as well through here and be delivered to the different organs, the intestines, the livers, the lung. All of the organs of the body need blood and need nutrients. This damage is precisely what happens in the disease known as vasculitis. Vasculitis is damage of blood vessels and inflammation of blood vessels. Itis means inflammation, and vascule means vasculature, or blood vessels. Essentially, this damage is caused by the immune system. White blood cells mistakenly release small molecules that can damage the blood vessels. Essentially, the immune system makes a mistake and thinks that blood vessels are foreign. So vasculitis is an autoimmune disease. Now I know what you're probably thinking. You might be thinking, if I destroy all my blood vessels, how is that compatible with life? Well, there are different types of vasculitides, the plural for vasculitis, and these different types might affect different parts of the body. So for example, one type of vasculitis might affect the lungs and the kidneys only. Another type might affect the intestines, the kidney, the heart, and the lungs. And still another type might only affect the big blood vessels that come out of the heart. The different organs affected in patients lead to the different symptoms that you might see. For example, loss of blood flow and nutrients to the heart tissue means heart cell death. This is known as a heart attack, and this might cause symptoms such as chest pain. The severity of symptoms might also be different. So for example, with abdominal pain, a patient might have a range from a small amount of blood in their stool to full-on bowel perforation. This all depends on how severely the blood vessels are damaged. Now, along with these local symptoms, patients might also experience general symptoms such as night sweats or a fever. So here's a little thermometer right here. This patient might have a fever, or a patient might have chills or generalized muscle aches, or they may also experience lethargy or feeling of being very tired. This all comes from what's causing this problem. Remember, white blood cells are releasing these little immune molecules. These immune molecules can travel down to the rest of the body. These immune molecules are normally used to fight off pathogens. And so a patient might feel like they have a general illness or a virus. So now let's take a step back. Why are only certain types of vessels affected in vasculitis? The different types of vessels that are affected usually depends on the size of those blood vessels. And so vasculitis has been classified into 3 different categories: large vessel vasculitis, medium vessel vasculitis, and small vessel vasculitis. So here I'll draw a blood vessel to show a little bit about what's going on. So here, let me draw this large blood vessel, and I've got the blood vessel wall and the outside and the inside of the blood vessel, out and in. And of course on the inside you have the things like I mentioned before, blood, oxygen, nutrients, that all travel through your blood vessels like water through pipes. Now the purpose of large blood vessels is to get blood distributed quickly through the body to where it needs to go. So if we have inflammation and damage of the blood vessel wall, so it's bulging out from inflammation, swelling, scarring, and then repeating that process, the blood trying to pass through can't do so effectively, and so there's decreased blood flow. And also after this constriction, you'll see decreased blood pressure as well. And now a physician listening over the skin using a stethoscope may actually hear this blockage. It's the same thing that happens when you put pressure on a hose. If you put a kink in the hose, not only will water stop flowing through as quickly, but also if you listen at the kink, you can hear that blood trying to rush through, and that's the same thing a physician hears. This is known as a bruit. And if a physician feels the area, they may also feel what's called a thrill, this feeling of blood rushing through. Now for medium-sized blood vessels, when scarring occurs for these vessels, it can potentially block flow altogether. This leads to blood cells kind of getting stuck behind the blockage, and little proteins in the blood known as clotting proteins can form a clot and completely stop blood flow. Along with clot formation, you can also see the blood vessel wall bulge out. This is due to increased pressure. The blood has nowhere to go, so it pushes up against the walls. And since medium-sized blood vessel walls are thinner, they are prone to this bulging. It's kind of like when you take a water balloon and squeeze it in one area, all the water bulges to one side of the wall. The bulging and weakening of the blood vessel walls are known as aneurysms, and the most feared complication from aneurysms is rupture, leading to blood spilling out of the blood vessels. Last of all, the final classification of blood vessels are small blood vessels. And by small I mean microscopic, so we've got blood cells marching through nearly single file, and a very thin blood vessel wall. You can imagine that damage to this wall can lead to breakage of the blood vessel really easily. And depending on where the blood vessel is, that's where you might see symptoms. So for example, if the small blood vessels are in the intestines, you might see bloody stool. If the blood vessels are in the kidneys, you might see bloody urine. If the blood vessels are just under the skin, you might actually see a rash. That kind of gives a dotted pattern where all these different small little blood vessels have ruptured. So in general, the symptoms you see in vasculitis depends on where the blood vessels are that are affected, what size they are, and how severe the damage is.
Pathology. Vasculitis. Pathophysiology. Vasculitis occurs when antibodies fight the immune systems of the body. Essentially mistake the proteins on blood vessels to be foreign. Don't belong in the body. The immune system attack the blood vessels cells in the mesh. They learned how preponderant necrosis occurs to the blood vessels and how to deplete up fibrin impact blood flow. Tenosyna deaminase. Tenosyna deaminase is a purine catabolic enzyme is essential for purine metabolism to its ability to remove an amide group, both adenosine and 2-deoxysteroid. Next video.
So what is the cause of vasculitis? Well, to figure that out, let me go ahead and show you what's going on inside of blood vessels in a patient who has vasculitis. And so here I'm drawing the inner lining of the blood vessel, known as the endothelium, and I have another line up here. So this is the wall of the blood vessel. So like I said, this is the endothelium, or the inside lining of the blood vessel. It's lined by these individual cells. And here is the vessel wall. And so we have an outside and an inside of the blood vessel. And to really give you some clarity, let's go ahead and draw the other side of the blood vessel too. And because I'm lazy, I'm only going to just draw two lines to represent the wall. So inside of the blood vessel, we've got many different components of the blood. Of course, in the blood, we have red blood cells, which transport oxygen to the different tissues of the body. And of course, we have diffused oxygen as well. We'll also have different white blood cells, so these are blood cells of the immune system, and there are also proteins that float around in the blood. These are proteins like albumin or clotting factors. So all these little different confetti colors are the different proteins that are in the blood vessels. And of course, you have nutrients and other essential molecules as well. The reason I take the time to point all this out is because there are immune proteins in the blood called antibodies. Now, the purpose of these antibodies is to find proteins and material in the body that is foreign, so it's not made by your own body. Essentially, antibodies can act like a guard dog looking for intruders. And just like a guard dog, when it finds something it doesn't recognize, it alerts the owner that something is going on. Now, on the surface of cells and also inside of the wall of blood vessels, there are different proteins. And the issue with vasculitis is it's believed that these antibodies mistake these proteins as foreign. And what do? Well, just like any good guard dog, they'll attach onto it and tell the owner something's coming. And when they do that, they'll activate. And when they activate, they draw over these white blood cells. And the white blood cells will think, oh, we found something bad. Let's destroy it. And so they'll release all sorts of different immune peptides and molecules to cause damage to the blood vessels. What's more is these white blood cells will call more white blood cells. And pretty soon we have a whole army of white blood cells. This leads to a substantial release of these immune molecules to cause damage, so much so that a lot of them can flow downstream. And these molecules that flow downstream trigger the body to think that this is an infection. And so you'll get general symptoms such as fever, fatigue, chills, night sweats, muscle aches, and other symptoms such as these. So now let's take a look and see what happens after all the inflammation has taken place. So I'll go ahead and draw the blood vessel again. And so this is the blood vessel wall again, and here's the blood vessel wall up here. And so you'll now see that white blood cells have infiltrated into the blood vessel wall. And because they've released so many other destructive molecules, such as degradative enzymes that chew up proteins, we see a lot of cellular debris. Now, when the blood vessel wall gets damaged, there are different factors in the tissues that get mixed up into the blood. And guess what? The blood has clotting factors that react with these different tissue factors. There's one clotting factor known as fibrinogen. And once you release these tissue factors, a cascade of events known as the clotting cascade activates fibrinogen. Ogen actually means inactive protein. So fibrinogen becomes fibrin. And when fibrin is activated, it creates a net-like mesh. And of course, this net-like mesh is known as a clot. So if you were to take a look at this under a microscope, you'd see all this fibrin, this cellular debris, these white blood cells, and all this cellular damage. And this is collectively known as fibrinoid necrosis. Fibrinoid means fibrin-like, and necrosis means cell death. So you see a lot of cell death in here. So eventually this clotting leads to scarring and patching up of the blood vessel. But what you notice is this blood vessel is now significantly narrowed as to before. And so this makes it difficult for blood, nutrients, oxygen to really get through to the other side. And so really any cells or tissues, so these are just a cluster of cells I'm drawing, that are downstream of this blood vessel may end up dying because they don't get the nutrients and oxygen they need. And so you see local tissue damage depending on what blood vessels are affected. It could be your kidneys, your heart, your lungs, liver, intestines, wherever the blood vessels are damaged. And so for one final point, let's go back up here. With damage that has occurred to the blood vessel wall, some of these proteins that the antibodies have been targeting get released into the bloodstream. And when they do, antibodies bind onto them. And sometimes these antibodies can share these proteins and create this complex of antibody and the protein it attaches to. This is known as an immune complex. So immune complexes will also travel down the bloodstream, and they can get stuck in different parts of the body. Generally, the more common places these immune complexes get stuck are in the kidneys or the joints. And it's really not known why they prefer these locations. So autoimmune damage is the root cause of vasculitis.
Pros and cons. We observed a syndrome of intermittent fevers, early onset lacunar strokes, and other neurovascular manifestations. Lead to it rushed hepatosplenomegaly and systemic vasculopathy in three red patents. We suspect a genetic cause because the disorder present in early childhood. Next video.
Reactions.
ADA irreversibly deminates adenosine, converting it to the related nucleoside inosine by the substitution of the amino group for a hydroxyl group.
Applications in medicine. We observe a syndrome of intermittent fevers, early wounds, lacunar strokes, and other neurovascular manifestations, and systemic vasculopathy in three red patients. We suspect a genetic cause because the disorder present in early childhood. Next video.
Periodic fever syndromes are rare, long-term inflammatory diseases characterized by repeated bouts of fever in recognizable patterns. They are caused by gene mutations which affect certain proteins that subsequently cause inflammation. Here you can see 6 of the periodic fever syndromes caused by these mutations. Symptoms can include rash, fever, abdominal pain, and joint pain. A potential complication that can occur in people suffering with these diseases is amyloidosis, which over time can lead to kidney damage or failure. The prevalence of amyloidosis varies across the syndromes, from 15% of TRAPS patients to 50 to 60% of patients with familial Mediterranean fever. Periodic fever syndromes can have a profound impact on quality of life for patients and carers. Patients can lose time in school or at work during attacks. They may need to frequently visit the doctor for diagnosis and treatment, and specialist centres could be far away as there are very few existing centres of excellence. Because these diseases are so rare, they might be difficult to spot or take a long time to be recognised, and could involve extensive investigation, including surgery. To achieve an accurate diagnosis, a number of steps need to be taken, including genetic testing and monitoring fever patterns and the average length of attacks. Attacks can vary across the syndromes, from 1 to 4 days in patients with familial Mediterranean fever to potentially weeks or months in TRAPS patients. The average age of onset for the periodic fever syndromes can vary from infancy and childhood in CAPS to young adulthood in FMF. The prevalence of the diseases can also vary, from 100 to 500 in a million for familial Mediterranean fever to less than 1 in a million in PAPA. The prevalence of HIDS and Blau syndrome are unknown. Some periodic fever syndromes are known to affect certain populations more than others. For example, TRAPS and HIDS are more prevalent in populations of European descent, whereas familial Mediterranean fever affects populations of Armenian, Arab, Jewish and Turkish descent. Periodic fever syndromes can be difficult to diagnose. More research and investment is needed to help patients and their families who are suffering from these rare diseases.
Next slide. In conclusion, loss of functions mutation in CECR1 were associated with a spectrum of vascular and inflammatory phenotypes, ranging from early onset recurrent stroke to systematic vasculopathy or vasculitis, funded by the National Institutions of Health Intramural Research Programs and others. This is it. Thank you very much, Mr.